welcome to HFMA Talk, the podcast for NHS Finance. I'm Farida Khawaja, Senior Policy Manager at HFMA. In this episode, I will be talking to the 2022 HFMA winners of Finance Team of the Year, Staffordshire and Stoke-on-Trent ICS Finance Team. I am joined today by Paul Brown, CFO, Martin Richards, Head of Programme Finance for Primary Care, and Catherine Hope, Operational Business Partner in Finance. Welcome to the award-winning team. If you could just start by telling us a little bit about how you decided that you wanted to enter for this award. How did that come about?
We've been working closely as a system now for a while, and I guess we saw it as an opportunity really to bring the system closer together within the finance community. And obviously we like to win things, so putting ourselves forward to win an award was attractive in its own right, but really the main impetus was to bring everyone together across the system, because of course we work in individual finance teams as do all systems, but we've been keen to create a common bond across the system and get all of the finance community to work together for a number of reasons really. One, because that helps us drive the financial benefits across the system. If we can really look at the Staffordshire and Stoke-on-Trent pound rather than think about it as individual organisations, we're looking across the care pathway. We saw that as an opportunity to really get more benefit. But secondly, also just because if we can create a single team working together, it creates greater opportunity for people to develop, get more experience, work across different sectors, and really build a career in Staffordshire and Stoke-on-Trent. So for those two reasons, we're very keen to put ourselves forward for this award.
Yeah, I think, Paul, I'd agree with that. The main thing that we wanted to get over, I think, was the improvement that we've made in Staffordshire. That 4 or 5 years ago, we weren't working together as a system. The four organisations spent most of their time arguing with each other rather than working together. And it was a way to demonstrate how far we've come.
Excellent, Martin. So can I just ask a little bit more about how you went about the engagement? Because it sounds like you've come a long way from where you were. So was it quite a mammoth task to try and get everybody on board? And I'd like to understand a little bit more about the engagement piece and how you guys tackled that.
I think finance people in the NHS actually do work really well together and always have. And HFMA is really a really important part of that. It's a community where we do work together, and throughout my career, which is quite long now, I've always found that we work well as a profession. But as Martin said, really the financial regimes that we operated under did kind of create that separation and that tension in terms of, particularly between CCGs as commissioners and providers. It almost created this sort of tug of war in terms of the money. So yeah, we were keen to overcome that. So it did take some work. You're right, Farida. And we started, I suppose, with the CFOs getting together regularly, getting to know each other, just the human stuff around getting to know each other. Very lucky here in this system. That's I think why we won, because as CFOs across the commissioning and provider landscape, we do all see the world in a similar way. We've got different jobs to do, but we do respect each other very, very much. I think it comes from that, comes from the CFOs, and then we have a deputies group, which is equally a really, really strong group where individuals work together. So we had those sort of basic building blocks in place. We then had to work quite hard to actually create the mechanisms to allow the conversations to take place between staff of other levels in the organisation. So Kate, who's on the call, Martin, they helped set up some events that we had where we brought the whole system together. We did it on Teams, of course, but which helps get people together. But we had about 200 people joining, and we just talked about the financial challenges that we faced as a system. And so the feedback from people was that it was useful. People got to understand a lot more. So people in acute understanding more about primary care and vice versa. So really getting that sense of a more strong understanding across the system of the different jobs that we all do. And we just built it from there, really, just getting people together, getting people onto the same page. And as I say, you then drawing upon that already quite strong base of support through HFMA and through being part of the same profession. And then was the sort of the common goal, how do we put ourselves forward for this award and try and win it, which we did.
Excellent. Just on that, from my own experience of trying to do an award nomination, it can be a little bit like submitting a tender. So just out of curiosity, did you have anybody with sort of tender writing skills that helped you with this award, or was it just a bit of a team effort?
It was a team effort, but I'll bring in Kate now, because Kate, you did a lot of the pulling together, and we decided that we would get contributions in from across the system. So we allocated those out, but then it required Kate, you had to chase people down, didn't you, to get the entries pulled together?
Yeah, so I think we had like a small working group, and I think one of the things that worked well was the fact that we had people from all of the different partner organisations that were part of the submission. But then what we also did was we had staff at varying levels, which allowed the ideas to be both top down and bottom up, so to speak. It allowed us to almost collate and scope the best ideas possible for the submission. So I think that worked really well for us.
Yeah, and I think just to add to that, don't underestimate the amount of time that it takes you to edit the final version, because the word limits are really, really tight. And from what we ended up with as the final version, we probably had to halve it before we could actually submit it.
All right, okay. Yes, I can relate to that. It is a bit of a challenge, isn't it, trying to cut down the word limit, but making sure you're still getting the essence of the points that you're making. So yeah, Kate, job well done if that was down to you. So I also just want to ask a little bit more about the specifics of the award. So within that, you referred to creating an intelligent fixed payment system. Can you just tell us a little bit more about that and how that was how that was born and how you went about getting that in place?
Yeah, the intelligent fixed payment system went back a few years. That was as colleague of ours, Paul Taylor, who will be well known to many people in HFMA, who brought that into the system. And Martin referred to the previous disagreements that we had across the system around money. And in fact, Staffordshire and Stoke-on-Trent was apparently the record holder. It had the largest number of arbitrations and disputes. So on the back of that, Paul came in and proposed the intelligent fixed payment system. And at its heart, it's quite a simple concept. It basically says that rather than spend our time arguing over who gets what shares, the shares will be predetermined, and it just provides us a basic framework for resource distribution, so that rather than spending time arguing over that, we can get down to actually how to spend the money and how to make the services work within it. So we've taken it forward a number of steps since then. I suppose as the trust and collaboration has increased across the system, the mechanism itself becomes less and less important, and what becomes important is really working collectively and understanding that, if you go back in time, people would say, oh, well, all we need to do is, do this and this, and then just close beds down in the acute hospital. And of course, that's kind of impossible because you can't close beds in the acute hospital, etc. So getting to the point where we understand that actually we are all in it together. And if we're going to make the money last, we have to work together to collaborate over the care pathway across the different parts of the system. And so now, increasingly, the intelligent fixed payment system is more of a sort of model that sits there in the background, being a key driver, because we got beyond it in a way. We got to a place where now it is all about working together. But it was a really important first step, as I say, that took us from a place where we were in masses of disputes to a place where we could actually work together. So, well, Martha, you were there at the time, so you can talk a bit more, I guess, than I can about what it was like pre the intelligent fixed payment system.
Yeah, I mean, it was, I suppose it had two effects, really. I mean, we were spending a lot of time arguing with each other, and two of the organisations did go to arbitration. And, it stops you getting a proper handle on what the numbers actually are. Whereas now we know exactly where we are. Nationally, everybody's moved to a similar place, haven't they, with the block contracts as a result of COVID. But we'd actually gone there before that occurred nationally, and it really has allowed us to get a much better grip on the bottom line collectively, but it's allowed us to concentrate on other things rather than arguing with each other, as we used to spend a lot of our time doing previously.
Just as part of that process, I just wondered, did you need to upskill some of your finance staff to ensure that they were conveying those messages to the non-finance staff? And was there anything done in that particular area?
It has trickled down, I think, because, as Paul said before, we sort of started this thing at the top. We've had the away days, the virtual away days across the system. And then internally in each organisation, we have attempted to make it trickle down to other areas. Of course, it does take a lot of time and still getting through in places, but I do think we've made a genuine huge amount of progress on that front.
I think as part of your submission, there was a reference to a real change in culture. You guys had quoted somebody had come in and said it was quite a toxic one, described by one of the consultancies, to then moving to a collaborative and integrated one. And I think, Martin, you've touched on it, that these things do take time. But what would you say collectively or individually, what do you think were some of the key success factors in trying to change that culture?
I mean, it's there's no sort of magic formula to that, to be honest. But there is just a huge amount of hard work, and these things are based on trust. But trust, you can't kind of write it down and agree it. You can't just turn up in a meeting and agree it. It's earned, isn't it, over time? It's hard work over a concerted period of time would be my answer to that one. I think, as Martin has said, the changes to the financial regime, the return for urgent care back to block agreements, the period of over COVID has, I think, allowed all systems an opportunity to reset a little bit. So I would think, working across the country, I think most parts of the country now have made inroads. But to go the further step just requires that hard work, working together, building trust and supporting one another. And yeah, and it comes with time. Certainly going for this award did give us a bit of a process for that. We were doing all those things, but it gave us a bit more structure and a bit of a deadline, which is always useful, isn't it? And the submission, I think it was around September, we submitted the application in the run up to September over the summer. It gave us a bit of a impetus to make sure we did certain things, which I suppose speeded up that process of collaboration and trust building. But yeah, really, it is a long haul to get to a place of mutual trust.
And just given the financial pressures, especially in this sort of challenging financial year, I was just wondering, how is your finance team dealing with some of those challenges?
Difficult. There's no getting away from that. And the organisation, the system is under stress. We've got the competing pressures of significant workforce challenges, obviously exacerbated by strikes. We've got the demands to reduce waiting times, which we all want to achieve, but are very, very difficult. We've got the ongoing pressures with urgent care. We've got pressures on primary care that we've never known them. We've got increasing numbers of people needing mental health. The social care system is really, really stretched, and all of those things play out to us in finance. We're at the middle of all of that, and we want to be in a place where we can just hand out the money and make everything okay for everybody. But of course we can't do that. So we're working with really difficult set of circumstances, and that does result in a more stressful existence. I can't lie. But I think what we're trying to do here is just say, well, look, if we work together, we can't necessarily cure all of those ills, but what we can do is if we work together, we can make it better than otherwise would be. And I believe we are, and we are working collaboratively to look at how to make the money go as far as it can, to really work closely with our colleagues, and certainly the CFOs. We meet weekly, but we'd invite our colleagues across the different professions: HR, medical, nursing, the COOs. We talk together, and we work out how to balance these things off. So yeah, the strong finance team. Martin, you're one of the business partners, and as business partners, working closely with our operational leads to deliver, improve. That's really where I think we're making a difference. So I don't know if Martin would talk a bit about the role of the business partner, because that's crucial to what I've just said.
Yeah, I mean, I'm the business partner for primary care. So of course that means working closely with GPs and GP practices. And at the moment we've got the pod moving over from NHSE to ICBs. So it's forming good working relationships with the budget managers, which is what you'd expect any accountant to be doing. But I think it's also worth noting that as a result of working much better together as a system, and indeed the process we've been through with the system-wide finance events, and indeed going through the application for this award, the relationship has improved massively at all levels between the organisations as well. So I think everybody from, as Paul said, finance directors, but deputies, heads of, everybody's working together better and regularly meeting with colleagues at the other organisations. And I think there's a degree of openness that didn't occur before.
Another example, I guess, we could use, Kate, would be the work you're doing on, we call it a line-by-line review. And it started because we have to save money because of the financial challenges, but really it's becoming much more than that. It's about working between finance and operational stuff. This is particularly within the ICB, but the same has been rolled out. But I don't know if, Kate, you want to talk a bit about the work you're doing on the line by line.
Yeah, so the line by line reviews, I suppose it's utilising the business partner model in a slightly different way, and it's looking at each of the budget lines across the different portfolios. So I think one of the things that I've definitely seen over the last year is a change in mindset from commissioners. Historically, finance has very much so been seen as where there's a financial issue, it's very much so seen £, it must be finance. Whereas there's little things that are creeping in now where people are a bit more taking more accountability for the fact that they are part of the solution and potentially part of some of the problems as well. So one of the things a line by line is doing is it's literally a line by line review. So it's adding a lot of scrutiny to each of the budget lines and seeing if there's things that we could do differently, seeing if there's legacy things maybe aren't needed in the way that they're currently delivered. So it's allowing us to collectively come together at a very operational level, I suppose, get buy-in from people who ordinarily maybe not be part of those processes. So it's very much so all levels of the organisation are involved, from your senior commissioners to your commissioners, to your commissioning managers, and it's just getting them on board with us and scoping out opportunities.
Yeah, and having been involved in it, Kate, from a primary care point of view, it is actually surprising. It was surprising even to me as to how successful it's been, and I think it's certainly in part down to the fact that because of COVID for the last 3 years, there hasn't really been the focus on saving that perhaps was prior to that. And after a little bit of resistance from some people, having gone through the process, we have actually found quite a bit of money that wasn't being used effectively, and can either be redirected better or indeed go to the bottom line. So it was definitely an exercise worth doing.
That sounds absolutely amazing, and it's great that that's really sort of paying off now, and that you continue to enhance and build those relationships. So, Kate, that the line by line exercise, is that something that's done on a monthly basis by the finance business partners with the relevant sort of divisions, or is it done less frequently?
It's actually done more frequently. So at the moment we've got weekly meetings to review it. It's an ongoing process that's going to take place over the first quarter of this year, and hopefully then we'll have opportunities that derive from that review.
Great stuff. That'll really help with the efficiency agenda and the challenging sort of waste reduction targets that everybody's got to meet this year. So it's great that you're doing that sort of in the first quarter of the year, because then obviously you can then spend the rest of the year trying to build on those and making sure that those those sort of come into play. The other thing I wanted to just explore with you guys was, why do you think you stood out compared to your peers? I know there's been a lot of strong engagement, collaboration, spending the time building up the good relationships, but it's a tough award to win. So why do you think you guys stood out compared to some other people that had applied as well?
We're fairly unique in being where we are as a system. So there's some extremely strong, well-established finance departments in the NHS, but your system working is still in its infancy. So I believe that's one of the things that separated us from others at the time. I think going forward, for those, we were the first system award winners, and nobody else can be the first anymore. But what you can do is take that forward in terms of that system working. And I would certainly hope that for future awards there are a number of system awards, because I do think the big benefits, the big financial benefits, will come from that system working. The savings that can be found in individual organisations have largely already been found. Of course, there's always more that you can do from an efficiency perspective, but the big opportunities really are in the care pathway. And I think we can all see examples where things aren't as well joined together as they could be, and finance can be a conduit to that. So yeah, I would think that's what probably marked us out. But going forward, for those who want to be marked out, it's those who can show that they are working collaboratively and they are delivering real innovation and real benefits across the pathway that that previously wouldn't have been possible if you took a single organisational focus.
And I'd just like to finish by asking you all your 3 tips for winning an award, just so that people can sort of utilise and think about some of the things that you've shared on this podcast with us.
I won't use the one Martin used earlier because I'm duplicating them, but I think one of the things that we utilised was a teamwork approach. So making sure that you're scoping ideas from across. So in our case, because it was a system approach, it was important that we came together as a system and actually scoped across the system. So it's just making sure really that, you've got various people with different opinions at different layers of the organisation to come together and input.
Excellent. And has it had a real positive impact on the rest of the team? Just from experience, when you win an award, there's a real buzz, isn't there? And have you been asked to sort of go and speak to other finance teams about what you guys have done? So have you found that has it had any impact in terms of, I don't know, sort of like a staff temperature check? Are people just feeling a bit more motivated and, really proud to be part of such an amazing organisation?
It's definitely really, really valuable in lots of places that I'll let the guys talk about on the ground how people feel about it, but in terms of conversations that we have with regional and even national, to be able to say we are HFMA Team of the Year, because often the regulators are looking for evidence that systems are working together, and it's hard evidence. It's quite hard for others to provide. We can say there is the evidence, and I've used that quite a few times, I must admit. So it's been massively valuable in terms of our reputation and within the system. People in the system outside of finance I'm talking about now were really impressed and pleased. There's that real sense of success for the system, and again, it just emphasises to other people in the system outside of finance that actually finance is working well together. And once people know that finance is working well together, perhaps in the past some of the divide and rule type things people would have the games people would have played, that those no longer are played, because people know that finance is a tight knit community that works well together. So that for me, it's been massively valuable, and I've used it on many occasions. I don't know in terms of Kate, Martin, in terms of how it feels for those further down the organisation.
I think
obviously, as part of our application, one of the elements was around a business partnering. And business partnering's ineffective if you don't have everyone brought into it. So as part of our application, we obviously had like a managing director who spoke on it. And I think that the positivity around it actually cascaded down into some of what was then the MDTs that were happening. So the divisions now moved over to portfolios. But I definitely think that it wasn't just ourselves that felt the benefit. I do think that the teams themselves felt that they'd been part of it as well.
Yeah, that's absolutely right, Kate. Definitely, when speaking to the non-finance colleagues, that does definitely come across. And when speaking to finance colleagues from other organisations within the system as well, there were generally some very pleased people around.
And rightly so. Thank you very much. Is there anything else you want to share? I know we've done sort of the top tips, but is there anything else that comes to light that you think might help people that want to try and apply for this award again this year?
Covered it all. I mean, just embrace it and enjoy it. It's a good fun thing to do, and of course, if you get shortlisted, then that's the reason for having a good night out in London in December. So that it's worth doing for that reason alone. But there's lots of spin-off benefits, I think, as we've said.
Brilliant. Thank you very much for your time, Kate, Martin and Paul. It's been a pleasure speaking to you, and it's been really interesting just to hear about your journey. So thank you for listening to this episode of HFMA Talk, and don't forget to subscribe to this podcast to keep up to date with future episodes.